Welcome to National Kidney Day. I'm Dr. Ralph Clayman, and I'm a professor of urology in the Department of Urology at the University of California, Irvine. And my area of expertise is in kidney stones. And I thought it might be helpful on this important day to share with you some important facts with regard to kidney stones and you. So who gets kidney stones? Well, it is something that occurs more commonly in males than females, but it's a very common disorder, and upwards of 10% of males may have a kidney stone during their lifetime, and upwards of 7% of females may have a kidney stone during their lifetime. So this is an area of certainly concern, especially since the peak age for kidney stones to occur are somewhere between your 20s and your 60s, when you are actually most productive and gainfully employed. It is about 2 times higher in the South, if you will, but Southern California also, because of its heat, has a high incidence of kidney stones. One problem is that once you have a kidney stone, the chance that you're going to get another one within 7.5 years is upwards of 40%. Kidney stones each year cost upwards of $2 billion in medical expenses. So how do you know if you have a kidney stone? One way is that you get a sudden onset of severe pain on the right or left side of your back. This is an incredibly sharp pain and usually will cause someone to go to the emergency room when it does occur. You may have some nausea and possibly vomiting associated with this pain, and you may even have some fever and, on rare occasion, chills with this discomfort. You may also notice that there's blood in your urine. These stones are a variety of types, and in this particular slide are 2 pictures of the most common stone, which is calcium oxalate in its 2 forms. One is a dark form, which is very hard, and the other is a spiculated yellow stone that does break up much easier, if you will. But regardless, both of them can cause blockage of the kidney, which results in all of these potential symptoms and signs. So what's going to happen to you if you do have a stone? Well, if you're having this kind of pain, the first stop is going to be the emergency room, where they will likely do a CT scan to see what is the cause of your pain. And this is an excellent way to diagnose the presence of a kidney stone that is blocking the kidney or a stone in the ureter tube. If it looks like you have a small kidney stone that's stuck in the ureter tube, then you may be given medications to help you pass it if indeed it's small enough. On the other hand, if the stone is too large, you may well be admitted to the urology service at the University of California, Irvine Douglas Hospital, and there treatment for this stone would be undertaken. Fortunately, the treatments at UC Irvine for kidney stones no longer involve open surgery. What if you have a giant kidney stone? These stones can be as large as literally a tennis ball. When these stones affect the kidney, you run the risk of actually kidney damage as well as kidney infection. The entire white area of this slide is a kidney stone. However, today, with regard to our techniques, we can remove that stone entirely through a hole in the back no larger than the tip of your finger. By removing the stone entirely, we can preserve the function of the kidney, and if we're able to remove all the pieces of the stone, we can help prevent it from recurring. So lastly, how do I make sure that I never get a kidney stone, or if I have had one, how do I ensure that I will not get another? There's nothing more important than drinking a lot of fluid. The average kidney stone patient needs to drink at least 3 quarts of fluid a day in order to make 2.5 quarts of urine a day. Once you're doing that, the chance of any recurrent stone disease drops by over 50%. This is more important than any medication you can take or any diet. Second to drinking enough fluid is your diet. You should have a normal calcium diet, usually 1 gram a day, a low salt diet, usually no more than 2 to 3 grams a day, and low animal protein, less than 50 grams a day. All of this will help prevent a recurrent kidney stone. But again, diet is secondary to drink. Finally, if you have more than 1 stone, you should see your urologist for full metabolic evaluation and a treatment plan to prevent recurrent stones. In the Department of Urology at the University of California, Irvine, We have several experts with regard to treating kidney stones and preventing them from recurring. The beauty of the program that's been established by Dr. Landman is the fact that at the University of California, Irvine, there have been no open stone surgeries in over a decade, and likely there will be none in the decade to come. Thank you.